Hello, today we will tell you about Alzheimer's disease and I will explain the introduction and the causes of the disease. Uh, Please pass the slide. Introduction to Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that leads to the gradual degeneration and death of brain cell. It is the most common cause of dementia, a group of conditions characterized by a decline in memory, thinking, behavior, and the ability to perform everyday activity. Typically affecting older adults, Alzheimer's worsens over the time, has no current cure, but early diagnosis and management can improve quality of life. The disease is named after Dr. Alois Alzheimer, who first identified in 19th century 6 after observing brain changes in a patient with severe memory loss. Please. Okay. Causes of Alzheimer's disease. Six causes of Alzheimer's disease. First one is abnormal protein buildup, two genetic factors, three age, four cardiovascular health, five brain injuries and infections, and the last one lifestyle and environmental factors. First one is the abnormal protein buildup. What is this? Beta amyloid plaques build up between nerve cells, blocking communication, tau tangles from inside brain cells, damaging their transport system and causing cell death. Genetic factors, family history increases the risk. The ApoE4 gene is strongly linked to late onset Alzheimer's disease. Rare early onset causes are caused by mutation in APP, PCN1 or PCN2 genes. Age, the biggest risk factor. Most cases occur in people aged 65 and older. Cardiovascular risk, conditions like high blood pressure, high cholesterol, diabetes, and obesity affect blood flow to the brain. Poor heart health increases Alzheimer's risk. Brain injuries and infections. Severe or repeated head trauma might contribute. Some viruses, for example herpes simplex, may play a role taught research in ongoing. The last one is lifestyle and environmental factors, lack of physical and mental activity, poor diet and social isolation, low education level and limited cognitive stimulation. Thank you.
My name is Ayşe Elish. And types of Alzheimer's diseases. Alzheimer's diseases can be categorized into two main types based of at which symptoms begin. Early onset Alzheimer's diseases. Um, late onset Alzheimer's diseases. Alzheimer's diseases is generally classified into two a main type based on age of onset and genetic involvement. While the core pathology is similar, and the treatment approach usually in research and pharmacology can differ dependent on the types. Next. Alzheimer is not a one-size-fits-all condition. It presents in various forms dependent on individual factors. And there are several types of Alzheimer diseases based on age, symptoms, and genetics. Next. Early set Alzheimer diseases starts before the age of 65. It progresses more rapidly and may include symptoms such as seizures and difficulties with speech. This type is often caused by genetic mutation in certain genes. Next. Now let's talk about the most common form of Alzheimer's diseases. Late onset Alzheimer is the most common types. It begins after age 65 and usually starts with memory loss. Late onset Alzheimer's is the most common and widely studied if the disease. Next. And there are different types of Alzheimer's based on cause and symptoms. Family Alzheimer's is inherited and start early in life. Sporadic Alzheimer's is the most common and linked to aging and health conditions. Atypical type may cause vision, speech, or behavior problems instead of memory loss. And next. Family Alzheimer's is inherited and starts at a younger age due to genetic mutations. Atypical types or rare or may affect vision, speech, or behavior instead in memory. Next. Diagnosis methods of Alzheimer's diseases. Diagnosis Alzheimer's isn't based on one test. Doctors use clinic evaluation, asking patients and family about memory loss or confusion. They check if symptoms affect daily life and gets worse over time. Next. There are three main diagnostic tools for Alzheimer's cognitive tests like MMSE and MoCA check memory and things. Blood tests help rule out other causes like vitamin B12 deficiency. Brain scans like MRI or PET can show change in brain structure or activity. Next. Biomarkers in spleen fluid like low AB230 and high to can support Alzheimer's diagnosis, new blood tests or helping early detection. Genetics testing shows especially in early onset case with family history, but it not used alone for diagnosis. Next. According to DSM-5, Alzheimer is a major neurocognitive disorder. DNIAA classify it into three stages: clinically, MCI, and dementia. They also recommend usually biomarkers to improve diagnosis. Next.
In the early stages of Alzheimer's disease, the symptoms of Alzheimer's are usually subtle, but they can still interfere with daily life. Firstly, we have short-term memory loss, like forgetting recent conversations or appointments. Next, we have word-finding challenge, especially when they are reading, they tend to pause during their speech and using vague words like things, misplacing items. Sometimes they put things on their usual place, like putting the remote on the fridge or putting the cup on the bed because they are confused. Then we have disorientation. They are confused about dates or familiar places. They may have been to a place before and they don't seem to remember being there. Then we have change in personality. Alzheimer's disease affects their anxiousness, makes them irritable, they get easily irritated, and they tend to isolate themselves. They feel withdrawn from the environment. Then we have reduced judgment. They make poor financial decisions and they usually ignore hygiene. Next. Now, in the later stages of um, Alzheimer's, the symptoms become very disabling and uncomfortable. The hallmark late stage of Alzheimer's is dementia, their inability to recognize loved ones or remembering anything at all. Then we have loss of awareness of recent experience or surrounding. And sometimes they even wonder, they might leave their houses or their caregiver's place and just walk around in the street. Then we have loss of physical abilities like walking, sitting, and swallowing. Then we have incontinence. They usually have no control over their bladder and bowel. So we do experience urination, etc. Then several communication issues. Because their speech is so impaired, they tend to not talk at all or have very limited speech. And all this sums up to having complete dependence on their caregivers. Next. Then the risk factors of Alzheimer's, we have the non-modifiable risk factors. These are the biological or inherited factors that can cause risk, but they cannot be altered. We have age. Alzheimer's is usually seen, especially in the ages after 65. Then family history. If a parent, sibling, or relative has Alzheimer's, it is very possible for the traits to continue. Then we have genetics. Alzheimer's is usually affected by the APOE4 gene. Then gender. Women are most likely to develop Alzheimer's more than men. The ratio is higher in women than men. Then Down syndrome. Due to the early accumulation of amyloid, Alzheimer's is very prominent. Next. Then we have the modifiable risk factors. They trigger processes that make the brain more vulnerable to Alzheimer's, or if a patient already has Alzheimer's, they could worsen the Alzheimer's. Firstly, we have uncontrolled diabetes. Because of the blood vessels in the vein, the person is very close to getting Alzheimer's. Then high blood pressure. When there is reduced blood flow and cutting off of oxygen to the brain, it could lead to brain damage, or it could also lead to Alzheimer's. Then smoking, causing oxidative stress and inflammation in the brain. Then physical inactivity, weakened brain plasticity and circulation. Poor diet, this increases inflammation. When there's inflammation or there's like a brain infection, the person is susceptible to getting Alzheimer's, and it reduces brain's health. Then depression, Alzheimer's patients already, because of their problem, they tend to isolate, withdraw from the environment. So because they have depression, this could make brain shrinkage faster, leading to Alzheimer's. Then finally, lack of mental stimulation. Their cognitive features tend to decline. Thank you.
Hello, I'm Azra Tutar. Pharmacological treatments is my chapter. This involves medication that targets symptoms or underlying causes of the disorder. First one is cholinesterase inhibitors, for example, donepezil, rivastigmine, galantamine. These drugs increase acetylcholine levels in the brain, which helps improve or stabilize symptoms related to memory and cognition. And the second one is NMDA receptor antagonists, for example, memantine, regulates glutamate activity, reducing excitotoxicity, and is used in moderate to severe stages to support cognitive function. And the last one is combination therapy. Sometimes memantine and cholinesterase inhibitors are used together for better symptom management. And new and emerging treatments, monoclonal antibodies, for example, lecanemab, targets beta amyloid plaques in the brain, aiming to slow disease progression. These are never FDA-approved drugs, which ongoing research. Supportive therapies, cognitive stimulation therapy, group-based mental activities designed to improve memory and problem-solving skills, physiological counseling used to manage mood-related symptoms such as depression or anxiety. And the last one is occupational therapy, helps patients maintain independence in daily tasks. Lifestyle and non-drug interventions. First one is healthy diets. Supports brain health with antioxidants and omega-3 fatty acids. Regular physical activity improves cardiovascular health and may slow cognitive decline. And the last one is social engagement and mental stimulation. Activities like reading, puzzles, or social interaction can help delay progression. And the last one is future directions. Gene therapy, stem cell research, and neuroprotective agents are under investigation to potentially reverse or halt neuronal damage. Thank you for listening and your attention.